We could chat about some of the use cases of real-time location tracking in healthcare. We've also talked about that advice to staff and patients. Let's just focus a bit more on loss prevention. Just, I think I know what you mean by that, but go on, Steve.
So loss prevention, even round to IT assets.
Yeah.
So you mentioned that earlier. It's all very well having a device with Wi-Fi in it and connectivity when it's on, and then I'll get an approximate range. Now it might be connected to not the closest wireless access point either. The nature of networking, there's no guarantee it's necessarily sitting right underneath an AP. So I could still have to go off and interrupt lots of people looking for that particular device. It might be battery died 3 months ago, no one had a charger, or there wasn't a cable available or a plug socket. I mean, I've heard all sorts of stories. So even a small tag attached to one of these that are constantly transmitting, you're never going to lose it, for 6, 7, 8 years.
Would that be a tag like this? Or?
Probably a slightly larger one than that one. This is a disposable service, which is why it's so tiny. It's designed for up to 60 days for patients coming in and out, perhaps for rental equipment. But yeah, a slightly larger tag, and we're now moving to the world of stickers as well. So Bluetooth devices. Absolutely that.
Very simple and non-disruptive.
Credit card sort of size is where we're at now. So very flat. These sort of things can easily drop onto your IT equipment, and at that point, we're away, because you don't have to worry about losing it. But you can also geofence it. So you could say if that's going out of that department, it's going off site, it's found its way into an ambulance, whatever it is. All of that data is going to be captured there in the cloud.
Yeah, interesting. I think one of the challenges we had was that during the pandemic, a lot of equipment was bought and handed out. It wasn't necessarily used to the best of its capability, should we say, and sometimes things may have been hoarded or hidden away. And of course, now we've got to a position where it's actually quite hard to get hold of some equipment because of the worldwide chip shortage. The organisation needs laptops, it needs IT equipment. It probably has it, but it doesn't necessarily know where it is. So I think it's quite useful to the use case there.
There's a common point I just pick up on that one, which is around trying to reduce wastage and trying to prevent buffer stocks of anything, whether it's a clinical device or an IT device, whatever it may be. If we know how many we've exactly got, where they are, and how best to distribute them across the campus, we shouldn't have to constantly be buying new and buying more.
It's all about value for money, get the most out of what you got.
Yeah, absolutely.